Hey guys, I am back. So I'm gonna try to do this video in 15 minutes or less because I do have class in like a half hour. Another topic that I was just inspired by to talk about, which is positive psychology. It's a different theoretical approach to working with clients in clinical psychology and conceptualizing human behavior. So traditionally, there has been more of a leaning towards diagnosing people, like assessing people's behavior, diagnosing them, giving them this label of pathology, right? Of a clinical diagnosis. And granted, there's nothing wrong with that in and of itself because it leads to treatment. The person can get help. Once the person knows what is wrong with dealing with, they can get help and treatment for those symptoms. However, I work from a different perspective, and I want to talk about the downside to labeling a person. This whole idea of psychopathology, because it seems like that's what psychologists are obsessed with. Like, it's like an obsession. I'm seeing this around my colleagues, mainly my professors, and let's see. Okay, I don't know what happened. Something about bad reception. So I'm back. But as I said, like I kind of been noticing that, not necessarily amongst multiple professors, but one professor and a few supervisors like have this negative bias. They see things through their lens. And even though actually now I think about it, some of my colleagues slash classmates have been kind of looking at things. It's just psychologists in general, like therapists, psychologists, like they tend to have this negative bias. They see things through this negative lens, you know? And like I said, it's nothing wrong with diagnosis in and of itself, but it comes with reception, y'all. They almost don't want me to do this video, but I'm gonna go at it anyway. So diagnosis, like I said, there's nothing wrong with it in and of itself, but it comes with these byproducts, these side effects. You know, it's like, and especially it's how it's done, and the whole idea of labeling, because it can be quite annoying, and especially in the context of supervision when a student is just bombarded with all these criticisms. And it makes me think about Gottman's theory, because I find it interesting how you have these psychologists, these professors, these people who are in positions of authority, right? Because, okay, yeah, this is weird. What is going on here? Sorry, I think I flipped the camera around. There we go. Anyway, so they have this presentation as if like they are perfect, like they know everything, every like they've reached the pinnacle of knowledge, and I get it, you know, they may have been licensed for a certain number of years, you know, so with that they feel like they are comfortable in their skin, you know, they're experts, right? But I'm like, there's a danger to thinking that you just know everything, that you reach this point that of no, you know, at the top, you know, of knowledge where you can't learn, right? Like, it's something to be said about that. So in this video, I want to talk about this thing about positive psychology, and this the framework in which I work from. Because I like to focus on people's strengths. Not to say that focusing on a person's strengths in and of itself is going to fix them, because I had this discussion with one of my colleagues, and she was like, so are you saying that just focus on that alone is going to fix this person? And I'm like, no, not necessarily. But I think it's more effective when it comes to, when you compare it to the diagnostic part and in terms of bringing about change, then yes, I think emphasizing a person's strengths can go a long way. And this is not just in a therapeutic relationship, but across many different relationships. Focusing on the positive, not to say you're ignoring the negative, but not to place so much emphasis on it. And I think the error that psychologists make is that they place so, like almost the entire focus is on what's wrong. They hardly ever see the person for the positive traits that they bring. And I see the same thing is happening even in supervision, even with me personally. And that's why I decided to do this video. I'm going to keep track of the time. And yeah, because as I think about this whole thing about criticism and positive, you know, or what do you call it, constructive criticism, right? But it's really criticism, especially the way they deliver it. And it made me think about Gottman theory. Because he talks about, in his theory, he talks about the 4 horsemen of the apocalypse. Basically, the 4 biggest predictors of marital dissolution. You know, a divorce, essentially. Is the 4 predictors that he says are present in relationships or marriages that are headed for divorce. This is something that I've been learned many, many years ago in my undergraduate studies, like over 10 years ago. But it's come back up. Of course, I'm still in training. I'm trained to become a clinical psychologist. And it's something that a lot of marital therapists use. And I actually did a video on this like my first year as a PhD student a couple years ago. So you guys can go check that out where I talk about that. Just Google it, type in my name and Google Gottman and the 4 horsemen. I talk about and actually I think I labeled the video topic the predictors of divorce, I think. Or I just post a link below. But anyway, he says that these are the 4 horsemen. So it's criticism, contempt, defensiveness, and stonewalling. Very easy to remember. Criticism, contempt, defensiveness, and stonewalling. He says that if those are present in a marriage, in a relationship, you can almost predict with, I think, a 90% accuracy the success or failure of that relationship. And it's usually indicating that there's going to be a failure of the relationship because those things are present if they go unchecked. And I would like to say that it's not just for marital relationships. I think it's for relationships across the board. And this is the thing, I think the biggest error that a lot of psychologists make, especially those who are training up-and-coming psychologists, is like, okay, y'all know this stuff. You're reiterating it, you're teaching it to us, but you're not putting it into practice. There's like a disconnect between knowing something and putting it into practice. And I feel like that's what defines an expert, because a person can know all this stuff, but if you don't apply it to anything, you're not putting it into practice, you don't see these theoretical concepts played out in your relationships. I ain't talking about just personal, intimate relationships, but professional relationships, which are still kind of personal, you know, it's interpersonal relationships. You don't see these concepts played out, then how can, like, you're not even walking the walk, walking the talk. You're not practicing what you preach. You're just talking. You know, which makes a person think the person that you're teaching this stuff to is like, if you're not even putting it into practice, it's not even that believable. It's just like, oh yeah, they said that. That's almost like a child, right? A parent telling a child what to do. And it sounds all good. They put in very nice, eloquent language and all of that. But a child is looking at the parent's behavior. Modeling is the most effective thing, most effective tool in terms of parenting and teaching a child. Modeling. Not talking, modeling. So they're looking at the parent's behavior. The parent can say, oh, you need to have a clean room. But if they're not demonstrating that, how can you expect the child to do that? Same thing with these so-called experts and licensed psychologists. It's like, you are saying this about these are the predictors of a relationship breakup, but you're not even putting it into practice. And they're doing these exact things in supervision. Like, how can you know all this stuff about human behavior, but you're not putting it into practice? You know human behavior. And it makes me wonder, it's like, are you doing these things, these behaviors of the horsemen, to cause, you know, this problem in a relationship between you and your supervisee? Are you doing it to provoke something in a person? Like, what is your method? What is the reason, the rhyme for why these things are coming up? So I'm just going to go ahead and get into it. One of the most important things, I think, is the criticism. That seems to be coming up a lot. And according to Gottman, when he talks about criticism, I think he says it's like a 4-to-1 ratio, a healthy 4-to-1 ratio. So for every criticism, which he really says that it's more optimum to give a complaint as opposed to a criticism, but sometimes people kind of use those words interchangeably and see them as one and the same, is that for every complaint or criticism, you should have 4 compliments. That's healthy. But you don't see that. And supervision is just, you did this wrong. You are not doing this. You. And I'm like, how the hell y'all gonna teach us about how couples should be and how we should treat couples and give this psychoeducation to couples and treatment, but y'all doing the total opposite with us in terms of relating to us as interns? Something is wrong with that. It's definitely wrong with that, you know? And it's like, what do you expect? And according to Gottman, he says the more criticism there is, the more the person becomes defensive. So those two go hand in hand, criticism and defensiveness. You already got 2 out of the 4 horsemen right there. And you're wondering the success of that relationship, how is it going to turn out? What do you expect? It's not going to be good. It's going to be volatile. That goes for marriages and professional relationships. Business and business relationships is just as equally as important as intimate relationships. But it's like, it goes over people's heads. Because they think, oh, I'm licensed. I'm the authority. You do what I tell you to do. And as Dr. Phil say, how's that working for you? Because you got these supervisees, these interns, some of them are very compliant. They're very yes ma'am, yes sir type of interns. And I can be that way. I know how to adapt. I know how to change and be flexible to certain situations, right? But at the same time, I think I'm challenging myself, and even my therapist encouraged me to be more authentic. So is that really being authentic by just saying, okay, sitting there just like you in the chair, like they telling you, oh, you don't do this, you don't do that, you don't do that. You're just like, okay. How authentic is that? I'm like, I only can do that for so long before I express my thoughts and how I really feel. And I feel like this is supposed to be the field of psychology. We are supposed to be modeling for our clients how things should be, how we should behave and interact in situations. And how is that good modeling? How is that a good representation for our clients if, as even a psychological trainee, I can't even be authentic, no matter what kind of relationship it is? So that's the reason I'm doing this video. Something needs to be said to that effect. And you'll have supervisors be like, oh, well, there's a problem. We have an open door policy. You can just come to me and talk to me about it. That's bullshit. Because when I've mentioned it before and I've kind of contested what they've said to me in supervision, it's, oh, you're getting defensive. You're guarded. You're not receptive to feedback. There we go with the labeling again. Just throwing labels out there. It's like they learn all this clinical terminology, right? And they go to their head, and they just, anytime there's a misattunement or a disagreement, throw it out there and label you because they got all these fancy clinical terms. I'm just like, stop it. You don't have to impress me. They don't even know the right freaking words to use according to the situation. They just throwing stuff out there. I'm like, that ain't it. From my perspective, I don't see myself as guarded. It's not about being guarded. I think they're just misinterpreting. And I even called my professor out on that. This was like over a year ago, because he's a very great teacher, by the way. And I say that because although we had our rupture, we had a repair the exact same day, where he actually was misattuned to me and he misinterpreted something. So coming from the psychodynamic theory, he wanted to demonstrate to the class how to do interpretation, so he called himself doing interpretation of my behavior. I already talked to you guys about this, but he was completely wrong. And of course, I got defensive. That's only natural, right? Because I'm like, okay, you're not seeing me. So I got defensive. Not like, oh, I'm so combative, but I just kind of stated my perspective and how I see things. And he listened. And we talked about it after class. And it was an opportunity to repair that same day. And that was very powerful, you know? Because seeing that we was able to repair it the same day and it didn't like go on and drag on and on, it actually made me think about what he had said, his interpretation. I actually kind of think about it. I'm starting to consider like, well, maybe, possibly, small inkling part could be right, but not necessarily entirely, right? So it made me lower my defenses. That's a good psychologist. So I'm not making this video to say all psychologists are bad. No, you have some very good ones out there, and I want to give him credit. The one who taught my psychodynamic class, because he's good. He's great, by the way. And matter of fact, he's not even black. He's white, but he's great. So that's one example. But yeah, some psychologists are just so misattuned. They miss their clients. They misinterpret certain behaviors. A small example would be, okay, a client can come in, and let's say, I don't know, so many different behaviors. Let's say a client is swallowing. You see that, like, oh, they keep swallowing or something, right? A traditional psychologist will be like, oh, you must be nervous. I see you keep swallowing a lot. Everything they interpret, every behavior they interpret as something negative. You know, it gotta be nothing negative. Hell, the motherfucker probably just thirsty. Probably just want to drink something. But, oh, you're swallowing. I see you're swallowing a lot. You know? Everything in their eyes is a bad behavior. Like, almost every behavior is bad. You know, it shouldn't be that way. Another prime example that's actually more substantial is something I've seen with my own personal self and how people perceive me. And I made a post about this on yesterday on Facebook. I said, you may mistake my alpha female, I'm trying to remember the words that I use, my very direct approach, I'm trying to remember the exact adjectives I use. I got so many distractions around here, and I'm trying to make sure I keep track of time. But I said, you may mistake my alpha female, my very stern attitude, or demeanor for me being guarded, or something to that effect. You guys have to go to my Facebook page and get the exact wording, because that's what has come up. It's like I'm being misunderstood. People are looking at, just because I know who I am. Yes, I do consider myself an alpha female. I'm a leader. I'm a born leader, you guys. Like, just get with it. And I'm female. So I think for some people it's like a cognitive dissonance. It's like, okay, she's a female. She's very direct. She knows who she is. I'm like, she don't hold nothing back. So maybe she's defensive. They just throw out these labels, these negative labels. I'm like, defensive? No, I want to be understood just like any other human being. They have a need to be understood. That's a basic human need. Not to be misunderstood, but to be understood. And if I feel like I'm being misunderstood, then yes, I will correct you. I mean, I feel like I'm doing you a favor. But apparently people have a problem with that. And so one example I want to kind of hone in before I end this video is kind of going back to the same thing. This whole thing about, oh, she seems guarded. And it's just like, you guys have to go watch my previous video about this whole thing about being guarded, because I've kind of heard that word kind of thrown at me recently, right? And I'm like, I don't want to say it's not guarded. And that's another thing. From my perspective in positive psychology, I just feel like a client should have better insight. Some clients don't, and they go to therapy for insights. And that's the therapist's job, to raise their level of awareness, to help them better gain insight into who they are as a person. Not so much focusing on the bad. Yeah, the bad is there, and a lot of times they are very much aware of the bad. But a lot of times they're not really aware of their strengths that help them to get through the bad. So I feel like that's where my role comes in. But yeah, I feel like nobody knows a person better than they know themselves, man. Like, therapists can only assume, and they think because they've seen 1,000 clients and like, oh, I know this person, I know they type. No, you don't. Every individual is different. And so people have misunderstood me and like, oh, she's guarded, and I'm like, no. It may appear, just because something may come off as something, that could be an illusion, man. It may seem like that to you, given the situation, because you're not able to get whatever answer you're trying to get out of me, because you're not communicating. There's a lack in communication. There's something going wrong with the communication, that you're saying something, maybe I'm not taking it in the right way, or maybe you're not communicating it the right way. Whatever it may be, there's a barrier there to the communication, that you're not getting the response that you think you should get. And that's another thing, is you have therapists that have this expectation of what a client should say. They don't say that, and they just like, oh, well, you're lying, you're beating around the bush, or you're guarded. No, man, stop doing that. Just because things don't go the way you think they should go in therapy, as a therapist, stop putting these labels on people, man. I feel like that's another thing about the whole behaviorism. Behaviorism, it's all about punishment, right? You punish a person because they're not giving you the desired behavior. So you punish them to try to shape their behavior. And therapists do that shit a lot. Labeling is punishing, assuming something about a behavior and interpreting a certain behavior as negative all the time. It's like a kind of a punishment, you know? It's for the client. They're like, no, that's not who I am. That's not me. But that's how the therapist sees you. And that could create a disconnect between the therapist and the client. And that's not what you want. You want to build rapport with your clients, not to create a disconnect. And so being that a few people, I ain't going to say people in general, because that makes it seem like, oh, everybody think the same thing about you, so that it could be true. Negative. Because I made this statement in my class that everybody could think a certain way about African Americans. That don't mean that it's true. That don't mean that it's true. That could just be a factor of groupthink. That don't mean that it's true. Or propaganda. That don't mean it's true. So, yeah, the whole thing about guarded, I'm like, no, maybe perhaps I'm presenting in a certain way that appears as guarded because, number one, you're misunderstanding me. When a person's misunderstood, you don't get to see the delicate side of them. You don't get to peek into the deep side of who they are, because number one, you don't see them. You're misinterpreting them. And then the most important thing is that you're seeing them through a bad lens. You don't look at me through a bad lens and expect for me to just be all intimate with you, and you get to see the inner side of who Danielle is, which I don't have no problem being open. I mean, y'all should be able to get that by now. And it's funny because my professor's like, oh, well, you seem more emotionally invested in your vlog. Instead of him, he keep bringing that up, right? Which is really kind of annoying. I'm like, you're supposed to be a psychologist. You're the expert, right? Then you should know how to finesse the situation. He never get past that. He keep bringing that up. I'm like, dude, let's take it past that, okay? So you may have this assumption that I'm more emotionally invested in my vlog than in my class, which is really a false assumption, you know, to say about me. But I'm like, no, that ain't it. Just because you haven't seen me manifest myself in the class like I've manifested myself on the vlog does not mean that I don't have a stake in this class, because I do. And of course I want to gain something from the class. It's just that you have not been able to create an environment for that. Especially when you got students throwing out these criticisms and he's aligning with these criticisms. What you expect? Defensiveness. I just talked about this in my previous vlog. I mean, no, actually in this vlog. Criticism. And you misattune. You misinterpreting. And in terms of supervision and working in my clinical site, it's also some misattunement, because it's almost as if maybe for them, my supervisor, may be like, oh, well, she's not receptive to feedback. No, it's how you deliver the feedback. And I think they forget that not every student, although you have some students that enter the PhD programs directly from undergrad, right? So they're young, very young, different stage of life than myself. I'm young, yes, but I'm 35 years old. I'm not a freaking little baby. I'm not a recent college graduate. I've been there, done that. And so, yes, other students who are my age and even older may have difficulty communicating to their superiors how they want to be talked to or communicated with or related to. But I don't really struggle with that. I kind of struggle, I guess, with the idea of these repercussions that may come, because it's like, oh, they see things a certain way. They're like, oh, well, she's not receptive, so let me put that in her evaluation. She's not. That ain't even the case. I'm very much open as how you deliver it. I have professors that giving me all kind of feedback, in a certain way that's respectful to who I am as a person, as Danielle, and respectful towards my autonomy as an individual, respectful to my identity as an African American woman, respectful to my age as a 35-year-old adult and not a recent college graduate, and respectful to my experience, because I do have experience in my training, in my path, my career path to become a clinical psychologist. I have a lot of experience, but the ones who are not respectful to that, then those are the ones I realize I have some issues with being receptive to their feedback, because they be totally misattuned and the feedback is way off. Way off. They misinterpret me. They don't see me for the leader and the person, the strong person that I am. They assume that, oh, well, she's just a psychological trainee. She don't know nothing. There we go with the dichotomous thinking. It's either you know nothing or you know everything. Like, there's no in between. They don't honor that. I need a supervisor who's going to honor the in between. To understand that it's not that I don't know nothing. And it's not that I assume I know everything. But it's that I may be somewhere in between. And there's a lot of room to grow from the in between to knowing everything, so to speak. There's a lot of room in between there for me to grow, and I'm open to that. I love education. But you have to understand me as a person, understand my desires, understand that I'm a person that, yes, I like to kind of run the show. I like to be the leader. I like to teach. I like to learn too, but also I'm kind of moving more in the position of being a teacher and educator, of being a person that I can give something back. So yes, having been a student for so many years of my life, like I said, I love learning, so I consider myself maybe a lifelong student, but it's different stages to being a student, right? So I'm a kind of student where I'm at a point where, yes, I like to learn, but I also like to give. I kind of give and take type of thing, not just so that I'm a student and I'm just so naive and ignorant and I don't know nothing. No, I'm not. In that point in my life, I'm a student where, like, I've been a student for so many years that I need people to recognize that I do know some things and to meet me there, meet me halfway where I'm at, and honor that and respect that and understand that, yes, I do have a yearning to kind of be in control in a sense where I'm running this show. Like, honestly, put it out there. Like, maybe I feel like I should be further along where I am now in terms of already being licensed or already, which I could easily get licensed. Not that I can't get licensed. It's just a matter of applying, which I've been told that since I'm in a PhD program, it's just better for me to just work towards that licensure. But I'm qualified to get licensed, so it's not that, oh, I can't get licensed. I could have been licensed, but I've been in this program. I figure, okay, I'll just get licensed at the PhD level as opposed to the master's level. But yeah, I'm in a position like I'm ready. If y'all don't get that, like, the girl's so ready, and if people have recognized it, they're like, even my advisor in my dissertation chair, she was like, "You're becoming an expert." And I'm just like, oh, whoa, like, I didn't even think I was there yet, but she was like, "Yeah, you're becoming an expert." I kind of respect things like that. I respect somebody say, "Danielle, girl, you need to be teaching. You need to be already kind of, further along than what you are. Like, you are more advanced, so to speak. Like, I'm there, and I respect people who treat me as such. Not to say that I don't have opportunity to learn, because I'm always there to learn. even advanced people who've been licensed for many years still take CEUs, continuing education units, because they're always learning. Disrespect that. But you know what? I gotta go. Oh my gosh. I'll meet with my clinical training director today where we're supposed to discuss options for my third practicum placement. So yeah, it's gonna be interesting, and I need to actually revise my resume. I'm like, oh shoot, I ain't do that. Let me with her after this class, and we get a break, so I'm gonna do that break. I'm like, oh shoot, let me do that, let me do that. But yeah, I understand that maybe some of that resistance to listening to what a person is saying is like because is how you deliver it, and I'm more in a position where talk to me as if I'm an adult. Talk to me like I know something. Then you'll get a better response from me. If you're talking to me like A plus B equals C, what? I'm gonna look at you like, child, you done tried it. But hey, I'm gonna end on that note. Recognize a person's greatness. I wish more therapists would do that. And to see that some people are just born leaders, man. You know, so if you treating them in a position that they should be a follower, they should be a yes man, they should do that. Nah. A person could simply be facing resistance in therapy because they just have a different personality that you are not connecting with. You don't even want to respect because you see it as a threat to your own identity as the expert, the superior. You know? But hey, I can go on and on. I gotta go on that note. Love you guys, and I'll catch you guys in the next one.